have that tension, sort of that deep, achy sensation in the small of your back after you've been standing for a while, or if you've been walking for a while, those activities put us into extension. And if you have a diagnosis of degenerative joint disease or degenerative disc disease or spinal stenosis or osteoarthritis of the lumbar spine, all of those conditions they tell me that you're loading into those joints, and so you can get that deep achiness after you do an activity that loads the joints. If you feel that deep achiness all the time, there's probably something else that's going to happen. So I'm going to explain 3 ways that you can offload those joints. Okay? So when we move the spine in a certain direction, we can gap those joint surfaces. So maybe you do some exercises already and you realize that that makes you feel better. So flexion of the lumbar spine gaps those joints, takes those joint surfaces away, and kind of unloads the spine a little bit. So a posterior pelvic tilt, or both knees up to your chest. I'm just going to show you in sitting. So the one thing that I caution is if you have the diagnosis of degenerative joint disease of the lumbar spine and you also have osteoporosis or osteopenia as a diagnosis, you have to be a little bit careful and you have to localize that flexion movement to the lumbar spine to get the relief to offload or unload those joints, but not round through the upper back and mid back, so that you keep those spinal segments very safe. Those spinal segments are more at risk, especially when you have osteoporosis. So I'm going to guide you a little bit. Keep one hand on your chest. So your chest and your head is going to stay lifted, and we're going to do those pelvic tilts. So you put your other hand, just the back of your hand, in the small of your back, right where you might feel that deep achiness. And so you're going to keep this top hand still while you rock into the bottom hand. So you rock the pelvis back. You do that posterior pelvic tilt just to the point where you feel it stretch a little bit, and then come back just to a neutral position. So I don't want you to drop the chest and round everything. So just keep the chest lifted, don't move the top hand, and just move that bottom hand. And you can oscillate a little bit. And every time you rock into that posterior pelvic tilt, engage your abdominals, rock the pelvis back, flatten out that low back. That will give you some of that gapping of the joints and maybe some of the relief of that tension that you feel in your low back. So that's number 1, flexion of the lumbar spine when that's where you have the arthritis. And that typically is where we find arthritis in the spine. Neck, cervical spine, and lumbar spine, not typically so much through the thoracic spine. So the next one is, so another way is to get flexion and gap the joints. Another way is to get traction. So maybe you have had traction in the clinic. And one of the things I realized as I would give traction to folks in the clinic is that that's something they can't take home with them. There are home units, but they're very expensive. So ways that they could sneak some traction in during their day. So you take the back of 2 chairs. These are a little bit low for me, but they're just folding chairs. They're nice and stable. So if you have some that are a little bit higher where you can stand up straight, that's great. Maybe you have counter height stools. You could put your hands into the seat of the stools. But so I'm going to show you this. I'm going to put one foot in front of the other. So I'm taking the weight into my legs. I'm going to press my elbows nice and straight, shoulder blades away from my ears, and then I'm going to just bend my knees and let my arms hold the weight of my body, the bottom half of my body, so that I'm getting a little bit of traction or distraction through the entire spine. But you really want to try to relax in through the hips and let those thighs go and let the small of the back, the tension in the small of the back go, so that your stabilizing here and unloading the rest of the spine. I know a lot of people use the devices where you lock your feet in and you go upside down. That works too. That is giving you that traction or that distraction effect. But what you might try is to know if that's right for you. You can always try this simple traction frequently throughout the day just to unload your spine. You want to feel some relief immediately after you do it. Now, as soon as you release the traction and you walk and do whatever during your day, that tension is going to come back. So that brings us to the third way to unload your spine. So if you follow me at all, you know that I talk about fight or flight, living in this state of chronic low-level stress. And what that does is the nervous system then sends a signal to those muscles to be in the ready position, to be contracted. And over time, living with chronic low-level stress over many years then creates that tightness. So the muscles are both contracted and they also over time shorten or get tight. So if those muscles here are going to stay tight, some of the muscles, the abdominal muscles that anchor the rib cage down to the pelvis, if they are also in that state of contraction, if you feel like you can't get a big swelling into the belly when you breathe because the obliques are hanging on, you can stretch all day long. But that tension is going to come back into those muscles unless you deal with the root source, which is the chronic low-level stress that you're living with every day. So my suggestions to release that tension, it's more mental tension, is to meditate. The practices of deep breathing to make sure that these muscles are released. So the practice of deep breathing helps both mentally and physically. Mechanically, you can see if you can get the release. But the deep breathing also then signals back to the nervous system that it can be in a state of calm. You can move into the parasympathetic nervous system, the rest and digest phase, where we're supposed to be all the time. So again, if you feel that constant tension in your low back, there's probably a component of both. There's both, like I say, 50-50. There's 50% that's the body that's loading into those joints, that mechanical type pain, and also then the reason why those muscles are triggered is more from the mind or the mindful way that you're creating that tension in the body that pain is a symptom of. So give these three things a try when you feel that deep achiness in the small of your back. Find a way to create some traction and unload the joints through flexion. So I'm Stephanie Carter-Kelly, a physical therapist that uses yoga in just about everything that I do. That's why I add the breathing and the meditation as a way to unload your joints. Have a great rest of your day. Namaste.